I think it's important for us to recognize that we are a global community. We know that there are no fixed borders for infectious diseases, and in many cases we have open flow of people across borders, which of course adds to any kind of risk when we're thinking about a pandemic. Now, as much as we might like to forget what happened in early 2020, on March 11th, 2020, the World Health Organization declared a global pandemic of the coronavirus. And we have seen many, many changes in our world since then, and we know that there were many issues that affected nurses, even more particularly than the general population. One of the statements that we use in my country is that we must not forget what happened during the pandemic, what happened to all the people that we care for, and also very particularly what happened to the nurses and all of the healthcare workers. So we say there cannot be active forgetting. We have to learn from those lessons. And of course, the individuals that learned the most was through the lived experience on our front lines. So COVID-19, because of the SARS-CoV-2 virus, was something that devastated many lives and continues to have many effects. And at the same time, we recognize it's our responsibility to learn from those issues. We saw many scenes like this of nurses caring for each other, sharing the severe moral distress and injury, the erosion of mental health. It was a very difficult time, but nurses worked through it. Nurses were there for the patients that we all serve, recognizing that in many cases they sacrificed their own health and well-being and were concerned about the welfare of their families as well. So as we talk today about the effects of the pandemic and what does that mean for us to be leaders in recognizing that we must then influence future policy so that we have the right actions that we might take in another pandemic, it's important for us to look at what were the array of issues that affected nurses during COVID-19. Much of the information that I will share with you is from the International Council of Nurses, who served a very important purpose for all nurses around the world. One of the first reports was identifying the mass trauma that nurses were experiencing, not just the physical effects of illness, but clearly very severe emotional and mental health shocks. We saw nurses begin to leave the profession, whether it was because of physical risk, because many nurses with pulmonary illnesses themselves, or inability to be able to provide the care was significant, as well as, again, the moral distress that was so devastating to many. We also know that our educational systems had a lot of disruption. Some were able to carry on effectively, but in many cases, education stopped. There were concerns about having students in the clinical areas using the protective equipment. There was a concern about whether or not they would be safe. So we saw in many cases graduations were delayed, students didn't get the experiences, or they basically shortened their education. We saw many infections and deaths. And it was difficult to get those data, which I'll talk a little bit more about, but again, recognizing that that was an important piece of information, and ICN did its very best to be able to collect global data. Vaccine inequity not only affected many countries, but it was a serious concern that we knew nurses putting themselves in harm's way required that they had early access to vaccines, and that did not always occur. And the last item on this slide shows that nurses were very unhappy and in many places had job actions, meaning strikes or demonstrations, because they believed they were putting their lives at risk and were not being treated fairly, not being valued. So let me tell you just a little bit about the International Council of Nurses so that you can understand the work that is done and again appreciate that that as the voice of the world's almost 30 million nurses, has played and continues to play a significant role in understanding all healthcare and nursing care around the world, and are a very strong voice in terms of health policy. So ICN now has over 140 national nurses associations. In Japan, it is JNA that is the ICN member. And ICN was founded 126 years ago and was the first non-governmental organization to have official relationship with the World Health Organization and remains the largest of health professional organizations. Our current president, who followed me, is in the blue jacket on the front line. That is Dr. Jose Luis Cobo Serrano from Spain. He is the first man to lead ICN. And then you hopefully will recognize the person to his left, which is Professor Megumi Yamara-Tashima, who's a dear colleague of mine and is the second vice president of ICN. In the bottom left part of the page is Dr. Howard Catton, the Chief Executive Officer. There are 12 members of the board that represent the regions of WHO as they are elected to the ICN board. During the pandemic, ICN did a lot of work to make sure that nurses were informed, that it was a hub for information. So the ICN website had a variety of ways that information from the media and sent to the media was shared. And this was everything from internal communications to support that went out to the national nursing associations, the first of which was the Chinese Nurses Association. And then also articles representing the occupational risks and really demonstrating that it is important to prevent deaths of nurses. ICN raised the alarm on mental health and recognizing again that nurses' mental health was being ignored in many cases, and nurses were just expected to show up and continue to care for very heavy workloads of patients, and again, many of them were getting sick at the same time. Our largest nursing associations were urged really to take a lead in terms of continuing to share information. We also collected data on infected healthcare workers and deaths. Again, it was difficult to get that information, but we felt it was important to put in perspective what was actually happening to nurses around the world. So ICN issued a call for action, the first part being an urgent plea to get personal protective equipment. You will recall there were major supply chain disruptions, and some countries were able to share with others, but there was a real lack of supplies for nurses to be protected. The second part of the action plan was to be sure that all nurses had evidence-based infection prevention and control information and training. This was not something to be ignored because this was a lifeline to make sure that nurses were protected as well as protecting their patients. And then the third part of the call to action was this focus on protecting the health and well-being of nurses. So let me summarize some of the responses that were in the early phases of the COVID pandemic. So first and foremost, you heard me talk about trying to get the data. Data were very scarce, and some of it was the lack of communication with some areas, the lack of reporting to central agencies. In some places, the governments did not want to release information. And so ICN worked very hard, and we also worked through a group that we're part of called the World Health Professions Alliance, and that is the groups of medicine, pharmacy, dentistry, physiotherapy, and nursing. And so it was, again, the first part of the data collection had to do with what was happening with personal protective equipment for healthcare workers. We also sent many messages of support and sent regular updates to our national nurses associations. And in any situation, whether it was the COVID pandemic or other natural disasters, I can tell you that those letters of support have tremendous meaning and importance to our nurses in whatever country is experiencing that kind of stress. We also monitored infections and deaths of nurses, again, trying really hard to make sure that we were getting as much information as quickly as we could. And then unfortunately, we also had to collect information about the stories of abuse and violence and discrimination that were being experienced by some nurses. As we continued our desire to get more data, we also, again, were looking at understanding better the mental health and workforce support that was needed. One of the highlights was being recognized by the International AIDS Society's President's Award. It was issued to recognize courage, selflessness, and stoicism in fighting both AIDS and COVID-19. As you would imagine, there were some common themes in terms of stigma and in terms of risk. And so this was a very meaningful award. We also published a number of pieces about how to address the workforce needs. One of those really urging countries to make sure that they had a sufficient supply of nurses in their own countries. I'll talk more about the migration and the movement of nurses, particularly from low to high income countries, as a direct result of the pandemic. And then also publicizing the incredible work of nurses throughout the pandemic through the media was another important aspect of helping the public recognize that nurses were essential to their safety and recovery, but nurses also needed those same protections. One of the interesting early publications came out of Wuhan, China, as nurses were able to share with us what they believed were the early solutions to addressing the pandemic. And these solutions that they put forward, you will recognize as being essential throughout the pandemic. Everything from improving the social status of frontline workers to training in the protective equipment and having adequate protective equipment, making sure there was sufficient nurse staffing or manpower, better allocation of resources, and helping in the work environment, as nurses were not even allowed to go home in some areas, making sure they had places to sleep, making sure that they had access to food, and then again, more psychological support. So these tracked to the global needs that nurses recognized over and over again, everything from psychological support to personal protective equipment to testing for presence of COVID, and then housing and other peer support. So we were gratified that the nurses were able to share early on from China what some of their experiences were. So I mentioned ICN speaking to the mass trauma experienced across the workforce, and we know there were many causes of this. But it was clear as we surveyed our national nursing associations that the vast majority, 80%, said that mental distress was reported by their members. And that also included physical distress with exhaustion and fear, isolation, an increase in burnout. What doesn't come through in some of the information is there was great anxiety around exposing family members. And that went both ways. The workers were very afraid that they might bring disease home, but also people in their communities and families also didn't want their family members who were nurses and those working with COVID patients to actually come home. So there was abuse and there was victimization that was widespread. There were also COVID deniers, which was very difficult because as people tried to cast doubt on the pandemic, it was a moral issue for our nurses and caregivers who were experiencing post-traumatic stress disorder. We saw some increase in suicides, and then obviously we know many nurses suffer from long COVID. Now in Japan, 20% of nurses did report discrimination or prejudice around the spread of the virus. So while we don't have a global view of all of the quantification of the COVID effect, we know that it severely affected nurses everywhere. Even before the pandemic, the global nursing workforce shortage was a serious concern. And we had been looking at projections, particularly coming from the health workforce reports at the World Health Organization, that there would be a workforce shortage that could be as high for all workers of 18 million reported in 2016. And that number was also projected to possibly balloon to over 30 million nurses needed by 2030. We also know that what was being reported at the time and fueled by the COVID pandemic was that nurses were talking about retiring early, leaving the profession. So it was reported that 4.7% were going to retire, and 2 to 3 million nurses also talked about leaving because of COVID. So there were serious concerns of making the shortage much worse in many parts of the country. So ICN began to accumulate reports and be able to synthesize the findings so that we could help nurses around the world and our governments and the public understand what was happening. You may recall in 2020, that was supposed to be the International Year of the Nurse and Midwife that we were celebrating with the first World Report on Nursing. Well, that didn't happen because that was coming out in May of 2020. And of course, when everything shut down in March, it changed that schedule. But it still was important to recognize that the recommendations needed to be put forward because nursing couldn't be put on a waiting list in terms of how did we need to strengthen nursing. But at the same time, ICN took on the major role of collecting data and stories to be able to build strategies for the immediate effects and how to address the pandemic, but also strategies for retention and rebuilding the workforce. And I'll talk a little bit more about the two reports that you see highlighted there, Sustain and Retain in 22 and Beyond, and Recover to Rebuild, which was published in 2023. So the State of the World's Nursing Report was accompanied with an implementation plan, and that is the Global Strategic Directions for Nursing and Midwifery, which focused on 4 primary areas: education, jobs, leadership, and service delivery. And service delivery really is the focus for taking care of our workforce. ICN thought it was important to add to that list and focus particularly during 2020 on the safety of nurses and caring for the health and well-being of our nursing workforce. So in the first report that ICN compiled, which was Sustain and Retain in 2022 and beyond, we looked at multiple global studies and identified the mental health and well-being effects as the primary focus of this report, because this wasn't the first time that we began to shed significant attention on the mental health effects of the workforce. But it also led to looking at future strategies that needed to be put in place so that we could minimize the trauma and injury to nurses. Dr. Tedros, who is the WHO Director General, who's been a very strong advocate and friend for nurses, spoke to the threat to global health and the shortage. And you'll see the quote on the slide that recognizes nurses are the critical part of the health system. And he was acknowledging their key role on the front lines and says this report is a stark reminder of the unique role they play and a wake-up call to ensure they, meaning nurses, get the support they need to keep the world healthy. Another report that ICN participated in was with our colleagues at the World Health Professions Alliance. And so we put together a report that looked at all the experience across the health professions and had several areas that we thought were important to demonstrate the findings. The first was in the availability and distribution of the workforce. All professions experience shortages, vacancies, surge capacity of patients, and then also, recognizing that you couldn't just continue to do business as usual. Roles needed to change. We also know that the health of all individuals, including our workers, was very much affected by rising infections and death, high stress and burnout, and as we've already talked about, a high degree of mental health concerns. A third area being the working conditions, which really were consistent. Not enough protective equipment, too slow to get vaccinations. We also saw the violence and harassment increase in the workplace. We saw the reaction of workers through strikes, and again, an expression that there was not sufficient psychological support. And then the last area of social and well-being, we knew that health was being threatened because of the presence of so much stigma and deaths, and recognizing that individuals needed to care for their families and found that as a very difficult competing interest. Nurses really did experience post-traumatic stress. It was something that in many countries was really only talked about in terms of military exposure, but this was very serious trauma on the front lines. In a study reported in the International Journal of Nursing Studies that was called Global Prevalence of Mental Health Problems Among COVID Workers, reported almost half of nurses and healthcare providers globally reported mental health problems. And these were the ones that we've mentioned: PTSD, anxiety, depression, and distress. And so this was something that was new for nurses to be able to acknowledge. Nurses who are universally respected and trusted were now facing stigma and discrimination, which was a totally new type of exposure for nurses. In another research report from the Rosemary Bryant Research Center in Australia, and you'll see the partners in that, on the bottom left you see them listed: University of South Australia, as well as Nursing Now, the RNAO out of Canada, and a couple other groups, again recognizing that there were major concerns that were reported that leading to intent to leave. So recognizing that the work environment was critical in terms of how we could keep nurses not only at the bedside, but in a variety of roles that were so necessary during the pandemic. So this was one of the first pretty wide-scale nursing studies that were able to report data. One of the other areas that was looked at was what changed over the course of the survey about physical and mental health. So the picture on the left is physical health, and the picture on the right is concerns about mental health. The outer circle is at the start of the pandemic. The data on the inner circle is in May 2022, so 2 years into the pandemic. And what you'll notice is that in some respects, the concern about physical health diminished. It was present, but it wasn't not as severe. However, we saw more of an increase in the concerns about mental health in the pandemic data for May of 2022. So we've talked a lot about mental health, and I think this is probably one of the biggest takeaways from the COVID pandemic, that it was not always common to recognize the mental stress and strain that nurses have. And of course, it was much more pronounced during the pandemic. The World Innovation Summit for Health report that you see highlighted here, Our Duty to Care, really called out again the need for protection of mental health of care workers, and recognizing that nurses had not been protected. And we know that in nursing, moral injury is very, very challenging. And that is one of the reasons that many said it was going to be hard to return to the bedside. It was going to be hard to be able to continue to stay doing nursing work. At the same time, we also learned that it was important to recognize that resilience that is not an individual responsibility alone, but the healthcare system has a responsibility to make sure that we are supporting nurses so they can be resilient. We also know that many of the interventions that were needed to support the workforce were system interventions. Again, not just one organization at a time, but throughout the health system. And again, another reason to think about why all these data points are important to influence health policy. We learned very quickly that burnout was increasing. We knew that burnout was part of what nurses experience on a regular basis, but again, this became very obvious. The report that you see on the left, the Global Mental Health Nursing Workforce, was issued by ICN, which pointed out severe shortages in individuals who are educated and equipped to deal with mental health issues, all across the range of the different kinds of workers, everything from psychiatric nurse experts to psychologists to psychiatrists. There were several reports also from the World Health Organization and others pointing out the same problems in 2022. We just don't have enough mental health care providers. This storyline here, I think, is very, very telling. And again, these are the stories that you don't hear all the time, but individual nurses who were very fearful that they might bring illness home to their families, but more so the combination of worrying about the physical risk with the mental risk, feeling that guilt was also something. They couldn't take care of patients in a way they wanted to. They couldn't save the lives they wanted to. Oftentimes, in the most critical situations, nurses were faced with knowing that some patients would die because there just was not enough care. So a very, very difficult moral distress issue. Nurses also were confronted with trying to convince the public of doing the right thing because there was a backlash. People did not want to be quarantined. People did not want to wear masks. People did not want to socially distance. People were upset that businesses closed and that they were seeing a much reduced lifestyle. But I think this graphic is quite creative that was put together. It says, "We stay at work for you. Please stay at home for us." Again, recognizing that we needed to get to the public. And of course, nurses, being very trusted, were that great voice to say, "Please help us." So one of the other things we said through our ICN voice is that we needed to change the dynamic and what we call create a new normal. We needed to make sure that nurses were recognized for their critical role, and we could not be taken for granted. And this included recognizing a new status and level of respect for nurses, making sure nurses are involved in decision making, that we had enough resources, including staffing, that we were protected from all the risks of the pandemic, and that we were also being paid equitably. And in some areas that meant additional hazard pay, but also that pay was equitable. And so overall better working conditions, which was not a new agenda, but had much more urgency. Now you may recognize this individual, who is Her Royal Highness Princess Mona Al Hussein from Jordan, and she gave a very passionate presentation at the World Health Assembly for WHO in 2020, and her words really continued to ring true, that applause without action is no longer acceptable. So she was really the voice of saying it's one thing to say how important nurses are and how much we recognize that they do, but you know what? You have to be able to make good on the promise of recognizing the rights as well as the conditions of work, and that includes remuneration. So some of the early policy areas that were identified included the two reports that I mentioned. We'll talk about those just a little bit more. And those, again, the themes are very clear. Adequate staffing and good working conditions and pay, support for health and well-being, and having nurses intimately involved in system change. Now, the first report in 2022, Sustain and Retain, focused on how fragile our health systems are and some of the problems that occurred with nurse migration. So this was creating new shortages. For example, we know that in the Fiji Islands, 25% of their nurses left and never returned. So they were seeking better work, better jobs, and were recruited away. And there were many countries that experienced that kind of exodus. The main reason being that high-income countries were offering significant benefits for individuals to migrate. And some of the restrictions were not as severe at that time. So nurses did find ways to leave their countries. And so low-income countries lost many of their experienced nurses. And so that quick fix by high-income countries really became a reflection of some of the unethical recruitment that was occurring. ICN put forward a 10-year plan that follows the future of the nursing report and workforce. And again, these are the same themes that you've been hearing, but with some additional emphasis that reflects the problems that occurred during the pandemic. And this is not only staffing, but vaccinations and early vaccinations, making sure that there was constant reassessment of the workforce, making sure that countries knew that they needed to perform and produce their own domestic workforce, paying people appropriately, giving nurses recognition for their contributions, and monitoring, again, their overall workforce supply. We also know internationally some of these very same trends really were important in terms of the action plan. So implementing the global strategic directions for the state of the world's nursing, again, arguing and accomplishing early access to full vaccinations, redirecting recruitment so that it is ethical and it didn't compromise countries, making sure that workforce impact assessments are being done, and greater investment in low-income countries. That second report, Recover to Rebuild, really looked at investments in the nursing workforce. So this report will be of interest, I think, to all of you because it pulled together over 100 studies that looked at the impact of the pandemic, and at the time was very valuable in reinforcing what were the key issues that we needed to focus on because we believed there was a global health emergency related to the shortfall in nurses. And why did it matter? Health systems were failing. And we know that if we don't have sufficient numbers of nurses or nurses who can function at their full capacity, then we have, major issues. And so being able to heed the lessons and the urgency of fixing the problems during the pandemic were a real concern in terms of recovery and planning for the future. As I'm sure you've had discussions with your colleagues, it's not whether we will have another pandemic, it's when will we have another pandemic, and we want to be ready. So again, ICN was really critical in terms of building the evidence to support recommendations that would find their way into policy. And there's an excellent report online that you can look at, and just to give you a sense, there was as we drilled into what was happening with the workforce, it had to be put against what was happening to the people who were getting sick with COVID. There was a growing number of deaths. From March of 2020, we saw growth from under 1 million to over 79 million. And so what was happening in the workforce at the same time was looking at the fact that we had a crisis. We had insufficient numbers of nurses just about everywhere. We had this migration that was in some places devastating to low-income countries. We also had the concern that we weren't able to get data and that we needed to have more reporting and it needed to come more quickly. What we found in terms of trying to build this evidence was that informal surveys became the norm. And that's not the gold standard in terms of research data, but it is all we had. The other place that became very important was what we call the gray literature, which is just stories in the media, stories on the internet, case examples that people bring forward. But all of this was really important to bring together the picture of what was happening. And we saw by the end of December of 2021, what had been 79 million deaths had now ballooned to 278 million deaths. So again, ICN did an excellent job, I believe, in tracking these because there's nothing like a visual to show you the impact and really be the impetus to take action. So there really was an urgent need for workforce policy. No question. And this was everything from projections of what was happening as well as addressing the supply and demand issues and shortages and improving the work environment. Nurses reacted to the conditions that they were working in. There were mass demonstrations just about everywhere. And so we're in countries where taking job action or going on strike was not common, this became commonplace. We also saw, again, that the shortages were really much more severe in a variety of areas. Much of the nursing shortages before the pandemic were focused in African nations. And then we began to see, again, that spread all around the world with higher areas in some of the Pacific Islands and some of the Central and South American countries in addition to African nations. Once again, we said, you know what? The workforce shortages are the greatest threat to health and safety because without nurses, that line of defense is missing. But we also know that nurses said the working conditions that we are exposed to are absolutely unacceptable. And so again, fueled the demonstrations. A lot of it focused on recognizing that nurses did not have sufficient supplies and other staff in order to be able to take safe care of patients. And so it did lead to some positive movement and everything from pay raises to being able to really look at how staffing could be adjusted. There were also international reports on keeping staff safe, and these included the WHO Global Health and Care Worker Compact, which focused on worker safety and preventing harm and providing support. Also in one of the ICN reports, and I know you can't read this, I don't know if it's been translated, but this is a case example from the Japanese Nurses Association that highlighted that JNA lobbied for safety measures for nurses in multiple conversations with your government, addressed everything from infection risks to looking at strengthening public health centers and creating help desks for nurses. And they were also successful in getting some salary increases. So this is why the work of the National Nursing Associations has been so critical in addressing threats of the pandemic. Some of the other areas that are part of migration, once again, are really looking at the ethical nature of nurse recruitment and whether or not that can be controlled. Unfortunately, we saw a 60% increase in migration of nurses throughout the pandemic. And ICN spoke out very clearly that this was really a change that was not fair in all areas. Some countries like Canada and New Zealand eased up their requirements for letting nurses come in. At the same time, like the Philippines, that was typically exporting nurses, also had to look at restrictions because they needed to keep nurses at home. So there were many demands that were fueling this international recruitment, and you see several examples where vacancy rates or shortfalls of nurses were seen in a lot of countries, and these are all high-income countries that, again, were recruiting nurses: England, Germany, Switzerland, and the United States. One of the key data points that we've looked at was that with nurses migrating from Africa, probably the most important number on this page is when you look to the far right, of nurses who emigrate from Africa, 90% never return home. And so that is a serious drain of talent. So there's lots of impact of health worker migration, and it's important to note that there is a concern, again, that it is an economic concern. It is one that definitely affects relationships between countries, but also recognizing that this is a problem that comes and goes, and now we are still resetting the global migration. We recognize nurses will want to move for better jobs, and we can't stop that, but we want to make sure that countries are treated fairly. So the WHO has a global code of practice on the international recruitment of health personnel, and that's been the subject of several reports and strengthening over the last couple of years, which we anticipate will continue to receive a lot of attention. ICN, on the other hand, developed policy imperatives in 2023 that were issued with pretty much the byline of value, respect, protect, and invest in nursing. And that became the theme of the May 2023 International Nurses Day. And what it did was to bring forward our Charter for Change, which has 10 policy recommendations that you see on the slide, to really focus on how do we strengthen nursing for the future. And it's the same areas we've talked about before, but crystallizing them for government leaders to recognize that they have a role in creating policy that protects nurses, that ensures healthy working conditions, that addresses retention and positive practice environments, that also makes sure that the national workforce planning is funded in each country, that we have strong and accredited nursing education programs, that we know that nurses can have full practice based on their national scope, recognizing the value and contribution of nurses, engaging nurses as professional partners, and protecting vulnerable populations. And last but not least, appointing more nurses to executive roles. We know that in healthcare around the world, over 70% of the work is provided by women, and yet only 25% of leadership roles are held by women. So as nursing continues to be 85 to 90% women, this is also a concern that we want to bring forward. There was an article written by Elizabeth Iro, who at the time was the chief nurse for WHO, and Howard Catton, the ICN CEO, at the time of the pandemic in 21 saying we need to get ready for a post-COVID age. We need to make sure that nurses are the decision makers in designing this next generation of healthcare. We need to be able to influence our governments. We need to have long-term plans for self-sufficiency of our workforce. And so again, the blueprint was there and it continues to drive the development of policy today. Nursing leadership was underutilized during the pandemic, and so this is another way. Again, we talk about putting nurses in leadership positions, and we've learned from the data that were collected that we must do a better job of making sure that our governments recognize and involve nurses in any kind of critical event, as well as the ongoing planning for the future of how nurses contribute to their workforce. So I'm very proud to be able to have shared much of the work of ICN because they really are the global leader in terms of influencing policy for nursing and healthcare around the world. There are many projects that ICN does with leadership development, as well as looking at supporting nurses for humanitarian issues, as well as all of the work we do with the World Health Organization and the United Nations. So as we look at building the evidence to influence policy, you can look to ICN as the primary voice for nursing. And reflecting on the pandemic, we saw nurses in every country, Italy, Iran, Korea, Taiwan, all experiencing the very same things, all needing to benefit from strong development of policy. So clearly, we were all in this together. And I think nurses have that history of working together. Also, the work will continue as we believe in nursing the world to health. Thank you. Do you want me to close that?
Thank you very much, Dr. Cipriano. Such a wonderful presentation. And also you had a really hard time being a presidency at ICN. It's the hardest time I could imagine that too. Now, I think this now open to discussion. Any question from the floor or audience? Any coming from the chat? Okay. A chat. Okay, I think we have some questions. Okay. Can you start reading? Okay. では、お話ししてください。どうぞ。日本語でどうぞ。
ありがとうございます。Thank you for your inspiring presentation. I have a great interest in the concept of shared governance within the magnet model. Evidence shows magnet hospitals had low turnover during the pandemic. However, I'm curious about the conflict of interest in reality. In hospitals, clinical needs often conflict with a manager's personal interests or career survival. When a manager ignores a frontline proposal to protect their own position, how does the system stop this? Also, from your experience, how can you coach middle managers to overcome this conflict between personal and organizational interests? Is there a systemic way to solve this, or does it depend on the individual leader's personality? Please tell us.
So thank you for highlighting the Magnet program, which is now present in 40 other countries besides the United States. And it is true that they have lower turnover. And it all relates to the fact that in order to be designated as a Magnet organization, you must have supports in place for nurses. You must support a professional governance model, as you have mentioned. And also it recognizes the sharing of information as well as planning between our frontline staff and our management. What's important about what you mentioned as well, or the part of your question, is how do we help our middle managers to be able to address these needs? Because they are the ones that are often either translating what management wants to happen or needing to fight for the resources in their organization. What we tend to think about is that the organization does respect data, and so we often will coach our managers, and sometimes it's nursing in general, including the top-level nurse, that is the one that has to bring forward information, data, reports, and really lobby for more resources, not just the middle manager. So as you can imagine, in some cases it's a compromise. And in others, it's recognizing that by working through a description of what is it that's needed, is it more staff? Is it opportunities for better support for well-being? Whatever the issues are, is a dialogue that has to occur between nursing leaders and nursing management. Now, when that doesn't happen, we are seeing more and more strikes occurring across countries. And again, this is occurring in many countries around the world, mostly high-income countries, because there is this fear of job security, which you also mentioned. And it relates to the fact that nurses are still trying to gain the respect and investment that they need from their leaders. So personally, my encouragement is that we continue to grow leadership abilities and skills, that we have an understanding that if a nurse is in a leadership role, that a big part of their role is advocacy, and that's advocacy for the frontline staff as well as advocacy for the supports that are needed. So it is an ongoing issue in terms of providing that leadership in our clinical organizations to address almost all of the issues we talked about today, from sufficient workforce to sufficient supports, whether those are financial resources, mental health well-being resources, or supplies. So all of the things that we talked about requires strong leadership.
Thank you very much.
Okay, thank you. We have a question in Japanese. 筒井先生からのご質問で、素晴らしい講演です。ペギー・チンがコロナや戦争などの政治的、社会的、経済的な、経済ですかね、状況に対して開放的について述べていますが、開放地ですかね、に関するコメントをお願いいたしますというご質問です。
So thank you for the question. I have great respect for Peggy Chin, who I had the pleasure of getting to know many years ago, and she has always been such an incredible thinker. What she believes is important is something that is also a value that I believe we hold today, which is if we are going to be effective in leading the profession, we have to develop knowledge in other ways in order to influence change and influence policy. So when we think about the lessons coming from economic circumstances, as we think about the threats that our governments face and that are part of the geopolitical system that we're dealing with now, nurses have not always been educated to have that kind of knowledge. So I think it's important that we recognize where is it in our education. A lot of it is in our advanced practice education, where we focus on, again, policy advocacy, as well as recognizing the interaction between social structures, economic structures, and the professional discipline structures that we have. And so nurses bringing that knowledge to bear becomes really important. And countries express that in different ways. In many nations, that means urging or encouraging nurses to become much more politically active. It also means having nurses become decision makers in social systems, as well as advising and doing research that brings to light, again, these competing interests. So again, as we think about all the ways of learning and knowing, and we think about how nurses use knowledge, it's once again that reinforcement that nursing is a science-based, knowledge-based discipline.
Okay. Thank you. Thank you very much. And we have one more question in Japanese. ご質問は、素晴らしいご講演ありがとうございました。あの頃が思い出され、涙が出てきました。そう、PTSD です。まだ乗り越えておりません。私の周りにはそんな、仲間が何人かいます。何かお言葉をいただきたいと思いますが、いかがでしょうか？
Thank you very much for the courage to bring your question forward. Nurses have endured many very, very challenging situations. And it's important that we recognize that post-traumatic stress disorder is not something that goes away quickly. And there are these triggers. There are ways in which you're reminded again of what the terrible situations were and how that not only tugged at your heartstrings, but may have made it very difficult for you to go on with your work or to maintain relationships with family members and other treasured friends. So my advice is really to recognize that this may be a long-term recovery and to be able to make sure that you're getting the support that you personally need from family, from friends, and from professionals, and recognizing that it's okay to be asking for help. The statement that we often say is it's okay to not be okay, but making sure that you're getting the help to be able to recover. And be honest with not only yourself, but your friends if you're having difficulty coping, or if you have times where you just have to take yourself out of a situation and say, I need this time for myself. I need to be able to have time to care for myself, to care for my needs, and to recognize that this is part of that life journey. And it may be much more unique to nurses. And so the other piece may be to find colleagues who have had similar experiences, confide in them, and find mutual support. So I wish you all the best as you continue to recover and regain the strength that you undoubtedly have as a courageous nurse.
Thank you. Thank you very much, Dr. Cipriano. We'd like to hear more about from your experience a lot. I'm sure audience would like to listen more and talk from you, but the time is limited. So this is the end of the Dr. Cipriano's lecture. But again, thank you very much for your wonderful presentation. And we encourage from, you really encourage, our experience, and also your experience encourage our heart really how to deal with in the future. Okay, this is closing this lecture, and then from now 日本語でいきますがアンケートがこれから届くと思いますので、皆様方ぜひ、いろんなコメント、ご評価をお願いしたいと思います。今日はご参加どうもありがとうございました。それではこれで講演会を終わりにいたします。ありがとうございました。Thank you very much.
Thank you.
Thank you.